Welcome, everyone. We're excited to see you. All right, so my name is Jenny May, and I'm here with my friend Jennifer Buster. We are from Part C and Part B 619. The title of this presentation is Part C and Part B 619. We're here to share with you what's been going on since COVID began and how we are ensuring that children and families are still able to access their special education services. We would like to do a quick introduction. So we're going to do a little bit of a different one today. Because this is an early childhood session, please think of your favorite children's literature.
Ginny, can I?
Sorry, did I start too soon? Go ahead.
It's okay. No, not at all. We just want to give everyone maybe one more minute, and then we'll have just a logistical thing to.
Oh my goodness, logistics are important. I'm so sorry. Would you mind to go back one slide and then we'll start over?
Totally fine. Everyone got a nice preview actually, so yeah, we'll give it because people are still coming in, we'll give it another minute or two.
Those of you who got...
I'm not used to being so popular. I thought 30 was the cap. I thought that was all we were getting. Sorry, Jennifer, what were you saying?
Nothing. I was just going to say those that got the preview can already go ahead and start thinking about their early childhood book.
And the book should represent how you're feeling right now about things in the world. So I chose a little bit of a different one, but sort of Alexander and the no good, terrible, horrible, no good, very bad day, but just with an adult twist. But you can think of your actual early childhood book.
Yeah, they're still coming in, so we'll give it a little bit of time. It's kind of like popcorn. You just wait until there's only like one every couple seconds. Great. Okay, I think we'll go ahead and get started. So good morning or afternoon, everyone. Thank you so much for joining us in this session entitled BabyNet and Early Childhood Education Services in the Service Provision Challenges track. We're really looking forward to a great session. A few logistics before we begin. The session is being recorded and the chat is being archived. Attendees are in view-only mode to keep things orderly, so you cannot use your microphone at this time. We encourage you to use the chat box throughout the session to engage with the group. You can post here for any technical issues you experience, as well as any questions you would like to share with presenters. We will share these questions toward the end of the session. This session uses auto captioning. While these captions will not be exact, we hope that they can improve accessibility for all attendees. To activate these as a viewer, please look for an option on your toolbar that says Live Transcript and select either Subtitles or Full Transcript, which will appear in a sidebar. Your options may differ on a mobile device. Finally, if you are intending to claim professional development credit through SC, South Carolina Endeavors, for early educators for attending this session, please complete the submission form we are about to share in this chat box before the end of this session. I will make sure to share this a few times in case anyone misses it. This is essential to having the information needed to process your credits. Please remember that you must attend the session for its full 1 hour duration to receive the credit. At this time, I am very pleased to introduce our two panelists, Jennifer Buster and Ginny May. So guys, take it away.
All right. For those of you who got here early, this is a repeat, but I'm Jenny May. Thank you for having me today. We're going to talk about Part C and Part B 619. In the introductions, please type your name, your role, and a children's book that illustrates how you're feeling right now. I've seen some great ones. I saw there's a monster in my closet.
Put me in the zoo. Let me hold you longer. I saw that one. I love you, stinky face.
Where the wild things are. Ooh, that's a favorite.
The very hungry caterpillar. Yes, if you haven't had lunch yet, you're probably quite hungry.
Wonderful.
Good night, moon. We must have a lot of tired people.
Oh, it's almost the weekend. You can make it.
Right.
The very busy spider. Good one.
Oh, cloudy with a chance of meatballs. I saw that. That's a good one.
The little engine that could. Fantastic. All right, there's a lot of feelings out there, and I'm glad to see them all come in. Everybody's feeling a bit more positive than me and Alexander and the day that blended into every other day, like some Kafka-esque nightmare with no merciful end in sight. So that it's you could be doing worse. There's a bright side here. Next slide, please. Wonderful. Okay, so today we are going to do a welcome, an overview, and an icebreaker. So you can already cross one thing off the old to-do. We did that. We're going to think about the purpose of early intervention services and the rights of young children and families under IDEA. We're going to then move pretty swiftly into IDEA in the context of COVID. This is going to include some child find and Part C to B transition pieces, and then also the services as they're delivered by Part C and Part B 619. We'll have plenty of opportunity for some questions at the end, and then we'll do an optimistic closure. Thank you and goodbye. Next slide, please. All right.
All right. So I'm going to jump in here. Good afternoon, everyone. This is Jennifer Buster. I want to say thank you for attending this session and coming in and hanging with us after this early after lunch. Hopefully we'll keep you engaged and awake. The first thing we wanted to talk about a little bit are some of the differences between Part C and Part B. I saw in the chat, we have a lot of early childhood folks in this session. So this may be a little bit of a review for some of you, but I think it's important to highlight some of the key differences. So as we go through our session and talk about our slides, you'll have a little bit better understanding. So the first thing I'll mention for Part C is that we have a central directory. All of our referrals come in here to the Department of Health and Human Services. So we handle all of that here at the agency. Jenny, I don't know if you want me to go down the line or you want to sort of go back and forth, talk about school district referrals, go straight to your.
Yes, so for Part B 619, kids are referred right to the school district. You don't need to call the State Department unless you need help finding a school district or there's trouble with the referral, but kids go right to the district.
Yep. All right, central directory. Part C houses a central directory. It's actually located on the Family Connection website, and that's a place that families can go and professionals can go and gain additional information about Part C, locate providers and things like that.
The school district provides the services, so we don't generally have a directory for service delivery in Part B 619, the preschool services, but we certainly have resources around best practice and family connections, we include our Parent Training Information Center in a number of our resources as well.
Part C has regional offices. So we have districts that are all around the state that are local BabyNet offices. And then we have a wide net of a service delivery system that includes service coordination providers, as well as therapy providers and a number of others. So I'll go ahead and jump down. The contracted providers, we work with our, again, therapy providers. I think currently have about 400 therapy companies that employ about 2,500 therapists statewide and over 500 service coordination providers.
And then in preschool special education, the State Department is the state education agency that manages compliance and quality improvement structures at the school district who delivers the services to preschoolers with disabilities. And so we offer services in the least restrictive environment, which is a little bit different from Part C, but I jumped ahead there. Go ahead, Jennifer.
No, you're totally fine. Part C services are required to be provided in the child's natural environment. So our providers are in their cars, or they were pre-COVID. They're in their cars traveling around to see families and children where they live, where they play. So that might be a child care center, it might be a park, it might be the child's home. And they really are required to provide those services in those locations unless there's a justifiable reason as to why the child cannot meet their outcomes in that setting.
And so the least restrictive environment is where the preschool age student would be if they didn't otherwise have a disability. So again, it might be a child care center, it might be a Head Start program, it might be a First Steps classroom or a SURDEP classroom, or it might be another place entirely. So the least restrictive environment is the preschool version of the natural environment. Oftentimes kids are going into classrooms for the first time, and so that's included there, the variety of early childhood settings, which kind of gets at that next bullet. Preschool early childhood environments may vary. Again, anywhere the child might otherwise be eligible to attend is included in that continuum of preschool service delivery environment.
And finally, excuse me, eligibility for BabyNet services is based on a child's a diagnosed condition that has a high probability of a developmental delay, or a child having an actual developmental delay. Excuse me, I'm gonna have to take a sip of water. So in South Carolina, the eligibility criteria is a child must have a delay of 40% in one domain or 25 in two. So 2 areas of their development. And one thing I will say is eligibility criteria varies state to state. So just because a child qualifies for Part C services in South Carolina does not mean that if they cross the border into say Georgia or North Carolina that they would also qualify.
Oh, and that's a good point. Eligibility for preschool special education includes adverse educational effect. So if a child has a medical diagnosis for autism, however, there is no adverse educational effect in the preschool continuum of service delivery environments or the preschool environment, then what that means is that they might not be eligible for services through the school district. But when we think about eligibility and early childhood preschool skills to be ready for kindergarten, these are largely pre-academic skills, so include a variety of things like communication, language development, some of those cognitive skills, and so eligibility, it's determined by the school district, but using the criteria for the state, and there has to be a demonstrated adverse educational effect. Next slide, please.
All right, so I'm going to jump in here and start talking a little bit about Part C, since that's where children in the system would come first. And it's a little bit backwards, and that children go through Part C and then transition into Part B. But I think the reference that Jenny and I like to use is, and a lot of folks do, is a child is born and they're in a cradle, and as they grow, they graduate to a bed. So C to B, cradle to bed. So just a way to sort of remember it if you're not in the system. So where I want to start is the Individuals with Disabilities Education Act, which is the federal law that really tells us how we are to deliver services to infants, toddlers, and then older children all across the state. And it really governs our work. It guides us. The regulations tell us what we need to be doing. They spell out the rights for families, and that's what we adhere to when we're delivering services throughout our system. BabyNet, of course, is South Carolina's Part C program for infants and toddlers. Each state, again, has their own name for their Part C program. In South Carolina, it's been BabyNet for as long as I've been involved with it. And the Department of Health and Human Services is our state's lead agency, and that's been since July 1st, 2017. In 2016, Governor Nikki Haley signed executive order transferring the program from the Office of First Steps over to the Department of Health and Human Services. So it's been here for about 3.5 years now. Some current data on the program, just to fill everyone in. Since 7/1 of 2020 to last week, we've received a little over 11,300 referrals to the BabyNet program. We're currently serving just over 7,200 children, and our largest referral sources are physicians, primarily pediatricians, CAPTA referrals, which is the Child Abuse Prevention Child Abuse Prevention and Treatment Act. And that's the federal legislation that indicates that if a state receives funding, CAPTA funding, that they must also refer children who have a substantiated case of abuse and neglect for Part C services. And then finally, caregivers and parents are the third referral source. A couple of facts about the Part C program, just in general: our services are voluntary unless the child is in foster care. So at any time, a family can choose to leave the BabyNet program if they no longer want the services that we provide. They are provided at no cost to the family, and they must be individualized. The service plan that we use is called the Individualized Family Service Plan for that reason. Each child's services should be based on that child's unique needs and strengths and what their family wants the child to work on. Next slide, please. So we mentioned that we'll talk a little bit about child and family rights. And so I wanted to highlight a little bit about that for, again, the children in the Part C system. But one of the biggest things, if you've had a child involved in the system, or you know of a child, is we're insistent on families receiving prior written notice of any changes that impact their child. We're also always going to seek the family's consent when we suggest any sort of change, or when you ask for a change. We're going to make sure that you consent to all of the activities that are going on. You also have the right to have your child's information kept confidential. As I mentioned earlier, providers are out in the field, but there are very strict guidelines that they must follow to maintain confidentiality of child's records. And families do have the right to ask to see those records at any time. Families can can decline services. They can decline anything at any time, and they can't be held or in jeopardy of losing something else if they turn a service down. And then also be informed of procedures resolving complaints. So if at any time a family has a complaint, we have a process spelled out on our website where families can go and file a formal complaint, and then obviously they can also file an informal complaint. And that's not something we certainly want to see, but it happens from time to time, so we have to make that available to families. I think the main thing, and we'll talk a lot about this, and you'll see this later in the presentation, is understanding that even in the context of a national pandemic, that everything I've just outlined here is still required. The stress of COVID-19 and all that it's entailed hasn't changed anything regarding what our responsibilities are to deliver services to children and families in this state. So next slide. So I'm going to jump in and kind of start talking about COVID-19 here. When I started thinking about where to go with the presentation and how to sort of give you guys the information, it came to me that it sort of falls into one of three areas, and that is, what did we do from a communication standpoint as a state, and then how has COVID-19 impacted our practice changes? You know, how has it changed how services are delivered, what they look like for both children and for the provider, and then just some general COVID related information that just sort of fell into a general bucket of impacts and things like that. So next slide. So thinking about communication, I think that's been a struggle for folks both inside the system and outside the system. I mean, if you think about your own personal experience with COVID, communication has been the biggest thing. You want to know what's going on. You want to know what the numbers are every day. You want to hear how the vaccines are going. So when this initially hit and really started last year, almost a year exactly in March, the Department of Health and Human Services and the BabyNet program worked very quickly to try and disseminate information to providers. It's important to note that some of the things that we put in place had never been in place before in this state. So it's like, you know, kind of turning the Titanic on a dime. So we worked very quickly to get information out. We issued a number of bulletins and alerts that I've sort of outlined here. In addition to DHHS created a dedicated COVID-19 website to, again, try and just disseminate information and allow providers to come in and ask questions, and we would post the frequently asked questions that we received. So this just box outlines what we sent out, information to therapy providers, behavioral health, applied behavior analysis, and then several that were targeted just at early intervention providers. And when we say early intervention providers, we mean primarily service coordination providers that deliver special instruction and family training, which we kind of call the same thing, and service coordination combined. Next slide. So what did COVID do in terms of what services looked like, and really how did it impact the work that they do day in and day out? Again, I mentioned earlier, this was brand new to South Carolina. While there may have been other disciplines that were utilizing telehealth, it was not being utilized in the BabyNet world at all. So getting those memos and bulletins and alerts out as quickly as we did was pretty impressive, because again, this was not something that occurred in the past. So what we saw and have seen over the last year is sort of an ebb and flow with the delivery of individualized services. So, you know, back in March, I think folks started off with a hybrid. You saw some families were still receiving services face-to-face because nobody really knew what COVID was. They were still sort of juggling and trying to figure it out. And then as case counts, you know, rose dramatically, providers moved to a strictly telehealth platform where they were no longer seeing families face-to-face. And I think that started to sort of change again, and then the holidays hit. And as you can imagine, and everybody knows, the case count went way back up again. So again, the providers had to sort of pivot and change again and go back to more of a telehealth. So, and then the other factor that is always taken into consideration in our population with children is we serve a lot of medically complex children. And so it's really you know, situation where you have to talk with families, you have to check and see, is this safe for a child? Are we going to be putting a child in harm's way? So very, very stressful situation for families and certainly the provider community. Another change that we had to make was with our eligibility process. I mentioned earlier, that's here, it's done in-house here at the Department of Health and Human Services. And typically we had families coming in for those eligibility evaluations. And so again, as the case count rose, we could no longer do that. So eligibility is now using a modified version with telehealth, as well as using medical records to determine eligibility for children. I think the good news is I have included a little bit of data here. Initially, we saw a drop in the case counts of the number of children that were being referred to the program. And then it dropped for about 2 weeks, and then it just started to climb again. And so what I've put here for comparison is a data point we have to do December 1 count from 2019 with just over 6,300 children to the December 1 count for last year, which is just over 6,700 children. So we're actually up 385 children as of the December 1 counts. And a recent poll was done of lead agencies across the nation, and of the 38 that responded, 39 that responded, 36 have had decreases in their enrollment and only 3 have had increases. And so of course, South Carolina was one of those. And then finally, one positive, if there is such a thing related to COVID, is our indicator 7 data, which looks at the 45 days that we have from the time a child's referred to the time that we get a IFSP in place, has actually increased from 75.7% to 97%. So that means that 97, almost 98% of the IFSPs are being put in place in a timely manner, which is a huge increase, obviously, and is great for families. Next slide. One additional thing related to data, again, is we've also added 2 service delay codes because we knew that, we in the state have 30 days to get Part C services in place, and we knew that those were going to be delayed in some cases. So we've added some service delay codes for family, COVID family, and COVID system. And then I was also afforded the opportunity to really learn from other states. We have a number of weekly calls that then sort of went into monthly calls with other Part C programs where we learned a wealth of information about how other states were handling things. And then we were able to communicate some of that in some webinars. And Jenny and I have worked throughout this last year, really talking about transition, having lots of phone calls and emails to stay on top of any transition related issues. Just to keep, again, the lines of communication open between the 2 agencies and make sure that we're addressing all the things that we need to. Next slide. The last thing I just sort of wanted to talk about, again, this is more of a general bucket and just some impacts and things like that is, again, now folks are sort of back to the hybrid model. I think hopefully here soon, as early interventionists begin to get vaccinated, we'll be able to go back to a more face-to-face, again, dependent upon child situations and family situations. Many of the EIs and service coordinators and therapy providers were included in 1A, and so some have begun to get their shots. Initially, some of the companies did have to lay staff off because, of the unknown. They weren't able to see families. And so it sort of remains to be seen what type of impact that will have, if any, long term. And then you just need to be thinking about the efficacy and really thinking about this telehealth delivery model and, is it as successful? What does the data say? Are the children continuing to make progress? And will it remain an option going forward? I've not heard anything about it changing. But, will it go back to the way that it was prior to COVID where telehealth was not an option? So all of those things, are sort of out there. Nothing has been decided at this point, but they're just sort of food for thought as we go forward. So, and again, most important thing is the child and family rights have remained in place. It's our job to make sure that the services are still delivered and that the children get what they need. I'll throw it to you, Jenny.
Wonderful. Next slide, please. All right, so Section 619 of IDEA is the section of the federal legislation that speaks to preschool age children with disabilities. And some of the rights that are clearly delineated in this law include a seamless transition from Part C. What that means is that if a child has a disability and is being served under Part C, there needs to be a seamless transition with an IEP in place by the child's third birthday. And Jennifer's talked about this before, but the pandemic did not ease up this timeline. So services needed to be in place, and we kept in contact very closely to make sure that we could troubleshoot any issues that were coming up, and also that we could make sure that our systems were working together the way they're intended to. Also, eligibility of determination needs to happen within IDEA timelines. That's for children who are 3, 4, and 5, not yet in kindergarten, who didn't participate in Part C. We adhere to the IDEA timeline. So that means that within 60 days of consent being signed, they need to have an eligibility determination. Young children who are not yet the age of compulsory education are still entitled to a free, appropriate public education if they have a disability, and they need to have access to their general education environment and typically developing peers. This is a big challenge regularly in early childhood because we don't have public programs with the same pervasive sense that we do in first grade through 12th grade, right? I think you can kind of think about this if you had your own children on waiting lists to get into daycare. Now, we certainly have leadership in our state and national leadership that are visionaries and understand how much brain growth happens in the first 1,000 days of life and are pushing to increase the number of early childhood classrooms and sectors that young children can access. But it's a different sort of environment. So during a pandemic, it was still a different sort of environment. But the special education services are meant to be provided and embedded within that environment as much as possible. So I'll get to the details on how we tried to do that a little bit later. Last year, our most recently collected child count data shows that we served over 10,000 children, about 10,400 preschool age children in, with special education services. So Section 619. There were about 2,000 3-year-olds, about 3,000 4-year-olds, and about 5,000 5-year-olds. So you can see kind of a distribution of the number of children that we serve and their various age groups. Additionally, our top 3 primary diagnosis, primary eligibility topics are number 1, developmental delays, or I'm sorry, number 1 is speech language delays, number 2 is developmental delays, and number 3 is autism or autism spectrum disorder. Next slide, please. So during the pandemic, next slide, please. The rights and protections remained. I know that Jennifer talked about this, but it's important that you remember that still these rights and protections remained. So when we discuss a seamless transition from Part C to Part B 619, some of the things we did were more so in the COVID context than ever before. Part B 619 eligibility teams, they kind of look at the Part C data. So I don't have any data to say that this is absolutely happening, but I am hopeful that we garnered in the local teams, local areas, a closer communication and use of each other's information in the eligibility determination process. Moving on to the second bullet, we still had to offer access to services and access to typically developing peers in the least restrictive environment. Now, how these services are delivered depended on how the early childhood center was delivering their services too. So at the beginning of the pandemic, many school districts kind of shut down and services were delivered virtually, or folks were planning on this being sort of like an act of God interruption of services. However, compensatory services would attach on the other side. And what that means is they would be made up. So if you usually get 30 minutes of speech per week, but for the first 2 weeks in March where schools were closed, you didn't, then you'd get those on top of your regularly scheduled hours in the next few weeks or so. Turned out that the pandemic took longer than 2 weeks to sort out. So, so from that point, special education services were offered how the general education services were. And what we mean by that is if children were at home getting virtual services, the school district could offer services because in South Carolina, like many other states, we operate under local control. The state education agency manages the boundaries within what school districts need to operate in terms of special education service delivery, but the local districts themselves can decide so much on their own, which means there's a lot of variability around what happened next in the course of the pandemic. So if services were all virtual and in a preschool classroom, then special education services might be delivered virtually, or in some districts, we had folks who traveled or did phone calls or did increased training with parents who could then support their children at home as well. We also offered a great deal of advice and guidance to local special education directors. There were weekly calls, and there was also a group of stakeholders, so a group of folks who've agreed to have extra meetings with staff from the Office of Special Education Services. They would get together and they would go ahead and tell us what the primary challenges were, what exists in their school district, related to early childhood, but also children of all ages. So this was not a Part B 619 specific activity. However, preschool age children were certainly included there. So from that point, we learned that districts wanted some support around prior written notices. We offered information that could be edited, like a template brochure that could be edited based on the specific district to give to families and parents. We offered guidance around eligibility determination. For the early childhood specific eligibility determination, we would use a number of virtual assessments that they were not intended to be virtual, and so we had to offer guidance on how to not damage the reliability of that assessment as we move forward and try to make a determination. These meetings were weekly when we began, then they became every other week, and now they exist in a different sort of fashion as we roll out a new oversight and assistance monitoring structure. And so sometimes we're talking about monitoring systems in place, but other times we're talking about the pandemic and our services and answering questions that way. So every week, though, we still have communication with districts, and we've even increased times where districts can just ask questions of the staff at the Office of Special Education Services, and we call those office hours. So the same way a professor might have had just a time when they were in their office ready to answer questions, we do that as an office as well. Next slide, please. So, and I'm sorry, forgive me, I have touched on some of this, but local control around the virtual, hybrid, or face-to-face early childhood programs. We've gone over the guidance that was offered, and we also developed a COVID website. So the State Department of Ed has a COVID website, but also the Office of Special Education Services has a COVID website. The two are very much aligned, but because we know that there are some things that are just need a little bit more specificity around in special education, we were certain to make sure those were addressed in on our website. And then I just mentioned we have the calls with district leadership. Next slide, please. Okay, so I've included here for you a variety of resources that you can find on our website. There's the State Department COVID website, and we don't need to click all of these now, but I will see about making sure you can find them. Oh, golly, I'm sorry. Would you mind to go back just one? Thank you, thank you. There's also a remote learning portal. This is from the Department of Education as well, and it is, I believe it's preschool through 3rd grade, but it does include young children there as well. Then we have specific to special education, we have a virtual and hybrid resources page that districts, parents, teachers, practitioners can all use to do things like help young children regulate feelings, help young children cope with the big disruption in their schedule and things like that that are very important. You can find those sorts of things on that web page. And then there is a specific preschool section. So I've included all those there. All right, and I think we are just about running on time. So this is perfect. Next slide, please. Now, if you have any questions, I want you to feel free to, if you can, unmute yourself, or you're welcome to put it in the chat. I'm going to go back for just a moment because Jennifer, I saw a question in here that I think you might be just the one to answer. It came in earlier. The question was, what if there's an investigation of abuse and BabyNet is refused by the biological family when it's a family preservation case?
Yep. So unfortunately, that is not a situation where the child would be required to receive services. We've worked hard with the folks over at DSS and a lot of the work that they're doing around the Michelle H. lawsuit. And so right now, children who are in foster care, those families, those foster parents are not allowed to refuse BabyNet services. But in the example that you gave, family preservation case, I believe it's still going to be up to the individual family as to whether or not they receive services. And I think the other thing to remind folks is, you know, children can be referred at any time. So, you know, a family can refuse services 1 month and, you know, if there are concerns a month later, they can re-refer their child. And so I would definitely encourage folks to, you know, re-refer a child if that's an issue.
So Jennifer, there's a bit of a follow-up to that question. What if these services are medically necessary?
Yeah, I mean, that's the struggle for probably all of us on this call. You know, I think at that point it becomes sort of an issue for the Department of Social Services to handle. You know, if it's a situation where the parents are neglecting the child medically, then that's definitely their purview and would be something that, you know, they would be responsible for investigating. And then, you know, that I think that investigation could then result in, a change in placement for that child, which might change, whether or not the child receives BabyNet services. So yeah, those are tough situations, unfortunately.
There's another question for you. For premature children, is there a cutoff for eligibility?
I know I'm not an expert at our eligibility criteria. I know there are, I think, two different, so we have a diagnosed list condition, and I believe there are a couple of diagnoses related to, so very low birth weight and very low birth weight. I don't know off the top of my head what the cutoff is, but I can, I know I saw some folks on that were actually intake workers, but I won't put any of them on the spot. What I'll do is I'll make sure that I get the answer to that back to the folks so that we can send that out. I apologize. Any other questions? I'm trying to monitor the chat.
I haven't seen any yet, but y'all, this is your time. Any questions you have, if I don't know the answer, which sometimes I don't, I will find out and get back to you, I promise. Jennifer knows most of the answers, so.
Pat Lucas, thank you. Thank you so much. 1,200 grams or less and 28-week.
3 days.
Yeah, 3 days or less is what is used. Thank you, Pat. All right, and then we also have an activity. So if folks want to, you want to do the activity, Jenny, and then if folks keep thinking of questions, we can revisit and see if anybody's come up with anything.
Sure, we can stay on at the end. That sounds good. Next slide, please. All right. I don't know how many of you have seen this before, but this is called a mood meter matrix. Here, I want you to think about where you're feeling on a degree of energy. So 1 is like no energy or just 1 little bit of energy. And then 10 is a whole lot of energy. And then think about your pleasantness rating. 1 is very unpleasant and 10 is super pleasant. So think about where you are after having heard what we've done at the state level to support implementation of IDEA during a global pandemic with Fidelity. So think about how you're feeling given where we are as a system and after you've heard kind of some of the things that we've done. And let me see you type some words in the chat that describe how you're feeling now. Ooh, I see please. That's wonderful. What I'm hopeful to avoid are a lot of unpleasant feelings with high energy, like enraged. I would like to not enrage anybody ever. Focused. That's wonderful. Enthusiastic, happy, proud, satisfied, blessed. These are great, great feelings. Inspired, cheerful, easygoing, grateful. All feelings are valid and wonderful, though. Don't let me pressure you into not feeling enraged. If that's your truth, go ahead and tell me. Thoughtful. Wonderful.
Thank you for those of you who shared. We appreciate that. At ease, that's good. Lively, that's good. At this time of the day, lively is excellent.
Energized. That's nice. Okay. Uh, so I see some information in the chat. Somebody is taking disability information and wants to know who they contact. So, if the child is 3, 4, or 5, not yet kindergarten, you'll contact the child's school district. Jennifer,
Yep.
if the child is 0 to 3 or 2.5, I'll let you provide that information.
Yep. They can actually go to the BabyNet website, and we have one of the things that we've implemented since we moved here to the Department of Health and Human Services is an online portal where families and professionals can actually go in online and make a referral and upload information. So that speeds up the process and makes it easier on everyone to make a referral for a child. And then we also have the 1-800 number where families can always call if they don't have a computer. And again, I should have that number right in front of me, but I don't, but I will type it in the chat in just a second.
Thank you. All right. Good. Well, I thank you for offering that feedback. I would encourage you all to take your feelings and your energy level and think of an action plan that might further support young kids and families, young children with disabilities and their families. So whether that's sharing this information with others, whether that's thinking about how you might be able to empower parents to monitor their own child development and things of that nature, that would be wonderful. So think of an action step, hold it in your mind until you get it done. Next slide, please. If you need to reach out to Jennifer or myself, here is our contact information. So please don't hesitate to use it. Forgive me, my computer's giving me an announcement. And if you and you're also welcome to visit the websites as well, where you can find those resources that I mentioned before, and where you can also find all the memos from BabyNet. They're archived there, as well as the central referral portal. Next slide, please. Thank you very much. This is a strange time and we need to lean on each other, but we'll move around if we can do that. So don't hesitate to let me or Jennifer know if you have other needs or if there's a problem or something you'd like us to consider. And I know we'll work together to get everything squared away.
Absolutely. Thanks, everyone. I also put the BabyNet referral number in the chat for the person who was asking for that. Thank you for attending today. Thank you all for your participation. That always makes this go much better. So we appreciate it. Have a great weekend.
So thank you everyone for joining us today. Once again, if you are claiming SC Endeavors credit, please make sure to use the Google form with the link that I just provided in the chat box. We will be providing a recording of this session to all attendees via email in the coming days. Thank you to our presenters and to all of you for the work you do. Have a great day.